thank you so much for coming back. We're going to start and keep going with the learnings from the Accelerator and its partners with some partner spotlights. I'm going to invite some of our partners to come and sit and present. But just quickly, let me just say a few words. So whether our partners rescue people at sea, deliver healthcare to patients, educate young professionals, innovate through research, our partners have important and quite diverse experiences and lessons to share. Today, we want to put a spotlight on that, how they progressively turn their commitments into practice, and how their mandates have benefited from implementing climate solutions. First, we have Christophe Chaubeau, who's deputy to the general manager at Les Sauveteurs en Mer in France, the French Maritime Rescue Organization, or SNSM. For the past 10 years, he has worked on transformation and strategy in the organization. Starting as a financial controller, he later became deputy to the general manager, and today he's overseeing the organization's environmental roadmap as chief transformation officer. And then we'll have Mauler from Terre des Hommes Foundation, who's climate environment advisor at Switzerland's largest child's rights organization. He leads the strategic implementation of the organization's approach to mitigation, adaptation, and advocacy, bringing academic experience, professional experience across NGOs, private sector, and with a strong focus on resilience building and environmental protection. We also have Serge Breysse, who's joining us online. He's the general director of Solthis, an international NGO working for global health and healthcare access and strengthening healthcare systems in Africa. He's a physician with a degree in public health with more than 25 years of experience in international solidarity, humanitarian in Africa and Asia. He's also a lecturer at Sciences Po, and he's joining us online, has been a big proponent of One Health and helping it operationalize it inside Solthis. Each partner will have about 10 minutes to share something unique about their approach and experience of their own organization, and then we'll have a Q&A session at the end. So keep your question for each of three of them, and you'll be able to ask them. So please, Christophe, Louis, you can join me on stage. Christophe, you can take the floor, and Serge, I believe, is with us online, and you'll be able to speak as well. And yes, you have the presentation, you have the clicker, and you can move it here.
Okay, thank you. Okay, hello to everyone. Hang on, it's moving here, but it's not moving here. There we go, okay. All right, good morning, everyone. So I'm here to present SNSM's environmental roadmap, to share with you the experience of our organization and maybe some of the lessons that you could take from it. I'm going to go very briefly presenting who we are, just to give you a very rough idea, the way we built our environmental roadmap, and then I'm going to try and spend as much time as possible focusing on two key projects that we're currently implementing to give you a more concrete idea of what we're doing at the moment. So, who is SNSM? We're, as was mentioned, we are a maritime rescue organization. We have four main mandates: saving lives at sea and along the coast. We train beach lifeguards, and we provide civil protection missions as well in France. And our fourth mission is raising awareness of the risks at sea. Just a few figures from 2024, or 2025 figures aren't out yet. About 10,000 rescue operations per year, that's pretty constant. Roughly 30,000 people assisted. We've just got the number of training hours there. Obviously, it's one of our main areas of emphasis is the training we deliver. Our network, so as you can see, or not see on the map, but we're very, very widespread all along the French coast and in French overseas territories, in the Caribbean, as far as Nouvelle-Calédonie and Saint-Pierre-et-Miquelon. We have about 200 lifeboat stations that perform offshore rescue operations. We have 32 training and operational centers that train our summer lifeguards, and who operate out of the 230 beach rescue stations that we also operate. I'm just going to take a little bit of a focus here on our boats. I've put the figure, we've got 778 of them. This is going to be important because obviously this is going to be one of the major issues that we're tackling with our roadmap. We are the largest ship owner in France in terms of number of units, certainly not in tonnage. Obviously, some of our boats are quite small, but we do have a lot of them. And so this is going to be one of our key areas of emphasis in our roadmap. Just a few figures as well, just to give you an idea about who we are. We're a volunteer organization. We've got about 10,000 volunteers. very small permanent staff of 140 people roughly to manage the organization at a national level, but a very, very, very heavy volunteer basis. All of our rescue operations are performed by volunteers, and all of our local training centers and lifeboat stations are operated and managed by volunteers. So this is obviously very important with the way our organization is structured. I'm just going to make a quick stop here on, I just call it, why do we care? It's a question that we get asked a lot by people outside our organization. Why do we bother with an environmental roadmap when our mission is to perform emergency rescue missions? And actually, this is a question that we don't need to ask ourselves inside our organization. There are a lot of reasons that we feel the need to concern ourselves with our carbon footprint. Whether it's the changing sea levels, which impact us directly, whether it's the pollutions we see, whether the way it impacts our operations. But the most important aspect is that the one thing that all our 10,000 volunteers have in common is that they have a passion and a love for the sea. So that's the starting point. So actually, we don't really need any other excuse to be concerned with this. And this is one of the lessons that we took away from this initiative once it was launched at a national level. We discovered that actually there was a lot of interest and a lot of, it was very easy to mobilize our volunteers around this topic, much more so than on many other topics that affect our organization. So now moving on to our roadmap. Naturally, we started with the carbon footprint, which was largely carried out by CAA, that we're very grateful for as well. The key takeaways from this footprint was obviously where are our carbon emissions. No big surprises. Transport, goods and services, and investments are actually really important, and that's one of the aspects I'm going to come back to in a minute. This was actually a key element because one of the characteristics of organizations that we're a very pragmatic organization, and so what was absolutely essential was to identify where we were going to be able to act with immediate effects. Starting with this, moving forward from the footprint, we started building our roadmap. We had a very, very important mobilization of field volunteers in building the roadmap. Just briefly, we started 10 thematic working groups where we actually had to turn people away. There was a lot of very motivated people who wanted to participate in the initiative. So very strong mobilization, a lot of help from CAA as well to structure this approach and to make sure that every project we were going to implement was grounded in our operational realities. First of all, to make sure it was efficient and compatible with our mission. So from there, obviously, we, starting with the footprint, so we had our workshops. We set up a volunteer staff pairs to lead each of these workshops, challenge the solutions, and prioritize them based on their feasibility and the expected impact it would have on our overall footprint. And this is how we consolidated it all into a roadmap, which was finally published at the end of last year. And this is where I want to put some of the focus, is where did we put our focus. So this is where we expect to achieve the highest impact on our overall carbon reduction. Oh, I didn't specify as well, we're about looking at a 50% target, reduction target. I forgot to put that up there. Most of our efforts are going to be concentrated in two areas: purchases and investment, and offshore fuel. No real surprises there, but it means also that a lot of the things that are grouped into others are things that we're not going to look at in priority. We're really going to try tackling the highest impact solutions first. So inside this, this target, we've got about 16 solutions that have been identified. So far, we've formalized them into 24 different projects. And today, I'm just going to try and focus on two main projects that I think might be interesting for us today. So the two projects I want to focus on One is reducing our fuel consumption in our offshore operations, and the second one is extending the lifespan of our lifeboats. So they touch the two main areas that you saw on the previous graph, which is offshore fuel and purchasing and investments. So starting with our fuel consumption at sea. First of all, it's only 7% of our total reduction effort. However, that's not nothing and still significant, and it's an interesting project because it requires really changing the way we do things across our organization. Obviously, we're a rescue service. It requires at times that we focus on speed. However, the times when this actually matters is less than 5% of the times we actually put to sea. And this is why it's very important that actually, obviously, we're not going to worry about those 5%. When we need to be quick, we will be. But the 95% of the other times our ships put to sea, there is no immediate urgency. Most of the time, including rescue operations, it doesn't end with fishing someone out of the water. Most of the time, it's the picture you have at the bottom there. We end up having to go and assist a ship that's broken down for whatever reason, and we just tow it back into port. It's usually, if it's sinking, we're not going to be doing this, so there's no immediate urgency. There's no urgency when we run training operations. We also put to sea for a lot of other reasons, which I'm not going to go into, but the key element is we don't need to be fast most of the time. And so what we've started implementing is quite an involved project. First aspect is getting the data. So we started setting up installations and sensors on all of our ships to actually measure the exact emissions of our ships throughout every time they put to sea. And the other aspect is that data is going to be available in real time in the wheelhouse for the people who are operating the ship. The idea is that they adapt their speed, they adapt the rounds per minute of their engines so that to reduce consumption. And this means training all of our lifeboat skippers. There's about 800 of them, so that's a lot of people. But mostly it's about the mentality that we have to try and spread throughout our organization, that actually being mindful of this does have an immediate impact. Obviously, it has an environmental impact. It also has a financial impact because we'll be burning less fuel. That's pretty obvious. There are other aspects of this as well. We're also looking at, and we've already started, implementing recommendations to reduce the number of times we put to sea when we don't actually need to. For instance, for training operations, it's obviously we're a maritime organization. It's very tempting to put to sea whenever we want to. A lot of the training we do, like first aid training, you don't need to be at sea for that. So we started pushing for actually you could put to sea when you actually need to train maneuvering and things like that, but not for things you don't need to. And that actually, the training guidelines have already been issued. The second project I want to look at, is a slightly more complicated one. It's the extension of our lifeboat's life. One of the takeaways from our carbon footprint is that actually the biggest impact of our fleet is not the amount of fuel we burn, because each of our ships, even though we have a lot of them, they put to sea for a relatively small number of hours per year, compared to, say, for instance, a fishing vessel, sorry. Most of our impact comes from the actual boat's life cycle. And so that is one of the things that we started looking at, is how can we optimize our carbon impact through our boat's life cycle. One of the key aspects is that we've assessed that 40%, refitting a vessel to prolong its life only costs about 40% of the carbon cost of building a new ship. And so we're now moving towards a policy where, rather than trying to renew our ships whenever they reach their theoretical life expectancy, looking at ways to extend it as much as possible. One of the key aspects is that obviously this only works if we extend its lifespan beyond the relative carbon gain. It's pretty easy to understand. 40% of a new ship, if you don't extend the lifespan more than 40% of the theoretical lifespan of a new ship, we're actually netting a higher carbon cost over the duration. This is a pretty complicated process because obviously we have a lot of different ships. This is the 40% figure is an overall estimate, and right now we're really working into going into the detail with the help of the Accelerator to properly map for each one of our vessel types, and also with the specific condition of each individual vessel, so that every decision to renew or extend can be based and grounded in an accurate estimate of its carbon impact. So those are the two projects I wanted to detail, and just a final word, which also is one of the things that is part of our roadmap, and which so far, to be perfectly honest, we haven't really moved forward on, but it's one of the things that we are looking forward to working on, is collaborating with our European and international partners like the IMRF, which is the International Maritime Rescue Federation, or the RNLI, which are our British counterparts, with who we already have a long-standing and very good relationship, to work on certain aspects that impact our organizations. I've just given one example, which is quite emblematic. Our life jackets, that obviously we have to carry, have a restricted lifespan of 10 years. After 10 years, we have no choice, we have to get rid of them. We can't extend their lifespan, they have to be replaced. And now, what I've written here is that it's an international norm, SOLAS norm. Actually, it's a norm that's set by the manufacturer. So we're actually moving towards now addressing the manufacturers, because what SOLAS says is the manufacturer tells you what the lifespan is and you have to follow that. So obviously, now we have to go to the manufacturers to ask them how they can change their recommendations for an extended lifespan. So that's one of the aspects that we're looking forward to. As I said, these are just 3 of the projects that we're looking at, part of the 24 that we've identified so far. It's obviously a very long roadmap with a target that should end in 2035. And I think that's my time, so thank you very much for your attention. And questions will be afterwards?
Yes,
Yeah?
so Louis, if you can take the stage and share for Terre des Hommes. Thank you so much, Christophe.
Let me just move forward.
And just to check, the Serge is online and will be speaking next. Okay, super.
Great. Thanks a lot. Hello, everybody. Very nice to be with you today. My name is Louis. I work for Terre des Hommes, which is a Swiss NGO specialized in child rights. We are active in 27 countries across 4 regions, and we mainly implement programs in health, migration, and access to justice, with also transversal expertise supporting these programs in child protection, WASH, and innovation. In 2024, we supported close to 6 million children and young people across the world. So I just would like to thank the Climate Action Accelerator for the invite today. It's very nice and it's a pleasure to share a bit with you all about our climate and environmental approach. So we started in 2021, which is the year in which we launched our climate and environmental strategy, which is built around mitigation, adaptation, and advocacy. We also joined the Accelerator on the same year. It was initially to calculate our first carbon footprint and, of course, support us in developing our decarbonization roadmap. And I would say that since then we made I think a lot of progress. Of course, we still need to work a lot, but we advanced our decarbonization, but also we could start implementing adaptation project, and I will say more about this during this presentation. So Today I just want to share a bit with you around three main topics. So the first one is the institutional approach and how we link it to our core social mission. The second one is just to present one of our pilot projects in health and climate. And the third point that I will also cover is how we also align our climate commitment with other important strategic areas such as localization. So, just of course to say that the first impulse came from the field. Now, when we talk about our climate and environment strategy, I think our colleagues in the field are daily observers of the impact of climate change on children and young people, and they really urged the management to take into consideration those exacerbated risk for children and young people. So it was really the starting point, but then of course it has to come with a strong leadership and governance structure. So we had a new CEO who joined the organization in 2020, and at this time who pushed also very much for developing an ambitious approach on climate and environment, and I think it was key in advancing those objectives. Of course, the fact to have a dedicated position was also important, as well as partnering with expert institutions such as the Climate Action Accelerator. But what I want to focus on a bit today is the importance of developing a clear institutional narrative. So in our case, the question we had to ask ourselves was why climate action is core to TDH mandate. And of course, from the start, we wanted our commitment to be aligned with our core social mission, which is protecting and promoting children's rights. So I think the approach emerged at a good time for us, because it's also when a series of important publications came out. So the first one is, for example, the UNICEF Climate Risk Index, which found that nearly 1 billion children faced high climate risk around the world. It was also accompanied by other important publications, such as the General Comment 26 of the UN Committee on the Right of the Child, which really highlighted how climate change was impacting children's rights, different rights such as the right to health, the right to participation, the right to development, and so on, and also promoted children's right to a clean, healthy, and sustainable environment. And I think these findings echoed a lot with what we also already witnessed in the field. So, for example, we work in very climate vulnerable region in India, in Bangladesh, and we also provided some evidence through scientific publication about those impacts on the children's rights. So all this, children's rights, climate change, and also climate justice, of course, because children will inherit the full consequences of climate change without having caused it, basically. I think all that came together to really build this clear institutional narrative, which is important and which allowed to have internal ownership, I would say, of this new topic, strategic topic internally. So, of course, alongside the decarbonization efforts that were allowed by this institutional narrative, we have also started in the last few years piloting some climate adaptation projects. And one of these projects is the CRESH project in Bangladesh. So usually what we try to do is really like to link climate adaptation with our existing programs. So project on climate and health, on climate and migration, climate and WASH, and so on. And this one is on climate and health. So this is a project which is implemented in Cox's Bazar in Bangladesh. So I think it fits well with also today's and this afternoon's especially topics on health and climate. But basically, in a few words, so as you know, Cox's Bazar is characterized by a refugee context. There is an extreme density of population due also to the Rohingya crisis, of course. It's also a heavily stretched natural environment, and it's one of the most vulnerable, climate vulnerable places on Earth. With frequent cyclones, floods and salinization and heat waves and so on. So in this context, TDH is operating through two primary health centers and supporting also 20 other government-run health centers with WASH interventions. And of course, this health center, they are at the forefront of climate change, and their functioning is really threatened by climate change. So we see that in terms of access to the health facility, to service disruption, to service interruption, and also inadequate infrastructure and preparedness, those health centers can't operate anymore in case there is a climate crisis. So the whole goal of the CRESH project is really to strengthen the resilience of these health centers to the climate impact. And the methodology we use is draws on WHO CRESH standards, but also on the Climate Action Accelerator Vulnerability and Capacity Assessment Toolkit. And basically, to sum up a bit the project, it's about assessing the risk and vulnerabilities for each of the health centers that are considered, then developing adaptation plan and implementing the solution to make them more resilient. Just a few words about, I think, key lessons that we learned after a bit more than 1 year implementing the project. So I think engaging with the health authorities is key. We saw that by discussing with the main stakeholders at government level, we were able to adapt our approach and to also complement the project with key insights from the government point of view. Of course, the participation aspect is key, and it was already quite highlighted by CAA in its methodology. But I think in the case of Cox's Bazar, we also learned that it's really important to connect with the community representative, with the health staff, obviously. So it was an important aspect that we learned. And also another finding is that I think to build resilience, it requires really a system-wide approach, and that's something we came to understand during the project. And as a result, we decided also to expand our intervention from 3 health centers to about 15 health centers to really have a better impact at the systemic level. In terms of the next steps, I think we want to scale the intervention to other regions in the world in the future. We want to capitalize on this project. We want to also share the key learnings with relevant stakeholders, and we want to advocate, especially with the government actors, to scale this approach. And of course, we count also on CAA to support us in this, because CAA now with the different CRESH projects around the world, it also has a strong capacity to map and also to, I think, aggregate the results and learning to showcase the global impact of CRESH. Just before concluding, just a third topic that I wanted to really briefly touch upon, because Daninka, you already mentioned it before, but just to say that at TDH we also have a strong localization policy. It was important for us to align these climate action efforts with this localization policy. So it is in this context that we developed this collective cycle that was mentioned already before. But for me, it's really important to underline that it's also it was very much identified as a priority by our local partners to also build and strengthen some of their capacity on sustainability and adaptation as well. And so we are very happy to be part of this project, because it also complete our toolkit that we are developing for our local partners. So we are very glad to also be to participate in this project as also a participant organization, because we also learned a lot, I would say, from the other actors, especially regarding the climate adaptation aspect. So as a conclusion, to the question, how do we advance climate action at Terre des Hommes? So first, a strong institutional commitment rooted in our social mission in protecting children's rights. Second, a pilot project that build our value and strengthen the resilience of children and young people we are working with. And third, a strategic also alignment with other important topics for the organization, such as localization. So all this aligns well with our overall goal to protect children's rights and to a vision of future in a healthy and sustainable environment for all children in the world. And we can also count on CAA's support to achieving this. So we are very excited to see what comes next, and we are also willing to continue our efforts and to stay committed to those objectives. So thanks a lot, and yeah.
Thank you, Louis. Thank you so much. We're going to give the floor to Serge. Yes, super. Hi, Serge. The floor is yours to share more on Solthis, and then we'll have just a quick moment to ask questions to the three panelists. Can we get the sound on Serge, please? 1 second, Serge, so we can hear you.
Est-ce que vous m'entendez?
Yes, on t'entend maintenant.
Super, je te salue et je salue tout le monde. Merci beaucoup, vous pouvez mettre la prochaine slide, merci beaucoup pour l'invitation. Je vais commencer par présenter rapidement Solthis, puis vous dire pourquoi on s'est engagé sur ces questions. Et après ça, donner un exemple très concret de projet qu'on mène aujourd'hui avec l'appui de Climate Action Accelerator au Sénégal. Avec une petite touche de français, comme on avait entendu, j'ai vu que tous les speakers étaient en anglais. Alors je vais m'exprimer en français et puis les slides seront en anglais pour faciliter le suivi par les anglophones. Donc Solthis, rapidement, vous dire qu'on est une ONG qui travaille sur la santé en Afrique de l'Ouest. Avant de vous donner nos domaines d'intervention, je vous dirai, en écho avec ce qui vient d'être dit par mon collègue de Terre des Hommes, que déjà nous on a une approche partenariale très forte, on ne fait pas de substitution, on est toujours en appui aux partenaires nationaux, et dans une approche on fait du renforcement de capacité, mais aussi de la production de savoir pour faire du plaidoyer derrière qui nous permet soit de transitionner les projets vers les partenaires nationaux, soit de faire une mise à l'échelle. Et dans ce contexte-là, je reprends vraiment vos propos sur le lien fort que l'on voit entre des actions climat et One Health et la localisation de l'aide sur laquelle Solthis est fortement engagé comme un acteur de transition aussi vers les partenaires nationaux. Par ailleurs, on travaille dans 5 pays avec des équipes permanentes, mais grâce à nos assistances techniques, on a une capacité de se déployer dans l'ensemble de l'Afrique de l'Ouest. Next, s'il vous plaît. On vient à Solthis, on vient du monde du VIH initialement, et beaucoup de maladies infectieuses et émergentes, mais on a augmenté diversifier nos actions, puisqu'aujourd'hui on travaille depuis plus de 10 ans sur droits et santé sexuelle et reproductive, et qu'on s'est engagé maintenant depuis 4-5 ans sur les enjeux One Health et plus récemment même sur santé climat. Next. Je passe très vite cette diapositive, c'est juste pour vous dire qu'on a toujours une double approche, à la fois de renforcement du système de santé, et ça aussi c'est très important, ça a été signalé avant sur tout ce qui est sur la méthode crèche et sur les enjeux d'adaptation des systèmes de santé, où nous on pense avoir une expertise et une valeur ajoutée, mais on travaille toujours aussi au niveau communautaire et population. Next. Donc pourquoi on s'est engagé sur les enjeux climatiques? Bon, d'abord, j'y reviens pas parce que ça a été documenté, un peu évoqué déjà par les interventions précédentes. D'abord parce qu'il y a ce lien à deux sens entre les déterminants de la santé et le climat. Le climat ayant un impact fort sur les populations, ça a été dit et redit, mais aussi la santé étant un fort contributeur aux émissions carbone. Donc on pense, nous, en tant qu'organisation, qu'on a une responsabilité à contribuer aux efforts de réduction des émissions dans le secteur. Ceci d'autant plus que nos zones d'intervention sont fortement impactées par les enjeux climatiques et One Health. On travaille dans la zone sahélienne, on travaille aussi en zone forestière et côtière en Afrique de l'Ouest, où les enjeux et les liens entre les différentes santé et l'environnement sont très importants. De plus, nos thématiques santé sont très liées au One Health. On a marqué ici maladies infectieuses, évidemment, et tout ce qui est émergence et zoonose. Je pense que c'est clair pour tout le monde qu'il y a un fort lien là avec le One Health, mais aussi sur tout ce qui est droit et santé sexuelle et reproductive. On sait qu'il y a par exemple des interactions fortes entre les enjeux de maternité et le climat. Et on pourra détailler si vous le souhaitez là-dessus. Comme je l'ai déjà mentionné aussi, notre expertise bien sûr en renforcement de système de santé et notre modèle d'intervention, puisque le partenariat est très important, mais aussi tout ce qui est, on va dire, on se qualifie de faiseur de liens. Connection builders en anglais, je ne sais pas si c'est le bon terme, mais en tout cas faiseur de liens entre tous les acteurs dans les lieux où on intervient, mais aussi faiseur de liens avec les institutions, qu'elles soient nationales ou internationales. Donc nos projets ont toujours aussi valeur à mettre à l'échelle, comme je l'ai dit au départ, et d'influencer à la fois les ministères de la Santé et les institutions très locales et nationales, mais aussi de porter des messages dans les institutions internationales. Et je crois que là, tout ce qu'on a dit jusqu'à maintenant et le partenariat avec Climate Action Accelerator nous permet de porter justement des messages plus larges et plus globaux et on échangeait avec ma directrice technique en écoutant Terre des Hommes juste avant et on se disait qu'il va falloir qu'on travaille encore plus ensemble avec vous, avec Alima, avec CA pour porter des messages par rapport à tous ces enjeux qu'on est en train d'adresser. Voilà, donc nous on a un double engagement, un peu comme ça a été dit dans les interventions précédentes. On a d'abord un engagement au niveau de notre organisation et de nos pratiques opérationnelles. On regarde comment réduire notre empreinte à la fois au global, mais aussi dans notre manière d'agir, et puis aussi dans des projets très concrets, soit des projets santé-climat ou One Health direct, soit en réfléchissant à l'intégration des enjeux climat dans l'ensemble de nos projets, ce qui est toujours bien sûr un peu plus compliqué. Next. Nos engagements, très rapidement, parce que c'est débutant et puis ça a été pas mal expliqué précédemment, entre autres par Bruno, que je salue. D'abord, on mesure notre empreinte carbone, bien sûr, pour voir où est-ce qu'on peut améliorer et la diminuer, avec une mobilisation des équipes qui a déjà commencé. Entre autres, on a fait toute l'évaluation des déchets, ce qui a été un moment très intéressant à la fois au siège et dans les pays où on a des équipes permanentes. Ça nous a permis de développer avec CA une feuille de route qu'on a adaptée à notre réalité, et c'est ça qui est très important et qu'il faut dire à tous les gens qui écoutent, c'est que vraiment ce travail permet non pas d'avoir un modèle générique classique, mais vraiment de réfléchir sur la finesse de ce que l'on peut faire. Donc voilà, on va définir avec une mise en œuvre progressive des objectifs à 2030, et un des premiers a été donc de revoir notre gestion des déchets au siège et dans les pays d'intervention, et puis chaque pays comme le siège a pris des petits engagements avec ce qu'on a appelé des challenges qu'on se partage sur l'amélioration, réduction du plastique au déjeuner, tout un tas d'aspects très pratiques. Next. Je vais maintenant vous parler du projet Senayak, qui a donc lieu au Sénégal. On a la particularité à Solthis, souvent les gens disent mais le One Health c'est un concept, qu'est-ce qu'on en fait? Nous on agit concrètement, on a des solutions, on travaille avec des partenaires, avec Climate Action Accelerator, et donc on a eu un premier projet qui s'appelait Tielal de One Health avec AVSF, et aujourd'hui on développe Sénéa avec CA et avec beaucoup d'organisations. Peut-être vous pouvez mettre la prochaine slide. Voilà, vous voyez que c'est un consortium de partenaires engagés avec un cofinancement AFD et Fondation S que je remercie. Et vous voyez aussi dans cette slide qu'on travaille aussi avec des organisations très locales, dans le sens vertueux de local, c'est-à-dire vraiment en Casamance, là où le projet a lieu, et aussi des organisations nationales, bien sûr, et les institutions sénégalaises. Next. Alors chez nous, One Health, qu'est-ce que ça veut dire concrètement et comment on l'a adressé dans les projets? C'est avant tout connecter. Connecter, c'est mettre les gens ensemble, donc c'est donner du temps aux acteurs de la santé animale, la santé humaine, l'environnement. Je me souviens d'une intervention d'un collègue dans un autre fora qui disait moi ce que j'ai fait de plus important c'est partager les numéros de téléphone des différents acteurs, donc c'est vraiment cette connexion, cette mise en contact des personnes qui déjà fait la différence. On produit du temps, on achète du temps pour que ces personnes puissent s'asseoir, et on a développé une approche de cadre de concertation pour développer les priorités d'action collectives avec ces personnes. Next. Donc ces personnes, vous voyez, c'est à la fois des acteurs communautaires, les professionnels des trois santé, médecins, vétérinaires, agents d'hygiène, les institutions et les autorités du niveau le plus local en Casamance où a lieu le projet jusqu'au niveau national, et puis des partenaires techniques que j'ai déjà cités. Next. Donc concrètement, qu'est-ce qu'on fait? D'abord, on travaille avec toutes ces organisations pour définir les priorités, et vous avez là devant vous les priorités qui ont été définies sur lesquelles on travaille déjà. Donc d'abord en communautaire, la sensibilisation des ménages, en haut à gauche, mais aussi des formations intersectorielles des personnels des trois santé, ce qui permet aussi de créer du lien entre eux, au-delà de ce qui en sort, c'est aussi la démarche et la concertation qui a un impact réel. On travaille sur la gestion durable des déchets. On fait aussi de la restauration environnementale, je vous donnerai un petit exemple après, des campagnes de sensibilisation plus globales avec des émissions de radio, et puis l'évaluation de l'adaptation nécessaire des postes de santé avec la méthode crèche qui a déjà été évoquée. Next. Donc en chiffres, je ne reprends pas tous ces chiffres, vous les avez, je vous laisse les regarder. Peut-être vous dire que comme vous le voyez, c'est trois structures de santé, donc c'est intéressant, on rediscutera avec Terre des Hommes, parce que voilà, cette extension à 15 structures peut être quelque chose que l'on regarde, parce qu'on a des bons résultats. Et puis vous voyez qu'on a aussi des actions très concrètes, comme par exemple 10 hectares de mangroves restaurées dans une zone que vous connaissez peut-être en Casamance, où c'est très important de préserver la mangrove, mais aussi formation des personnels de santé. Next. Alors sur l'enjeu plus direct de renforcement de système de santé et action d'adaptation au changement climatique, vous voyez qu'on a tout un plan d'action qui va sur l'ensemble des postes importants qu'on a évalués avec CA. Donc ça va du réaménagement d'une salle d'attente, de la climatisation de la pharmacie pour l'adapter à l'augmentation des températures, jusqu'à l'installation de panneaux solaires, de réflexion autour de l'hygiène, mais aussi de formation. Et puis des activités en communautaire. Et une dernière activité qui me paraît importante à signaler, qui est aussi la surveillance épidémiologique. Et là, on pense que c'est très important d'être capable aussi de documenter avec vous, avec les collègues dans la salle, de documenter la transformation épidémiologique liée au dérèglement climatique pour plaider aussi sur de nouvelles actions. Next. Alors la suite de la preuve à l'impact, c'est le système Solthis, comme je vous l'ai expliqué, c'est-à-dire d'abord on met en œuvre, on travaille, donc vous voyez on est en train de mettre en œuvre le plan d'action qui a été défini dans les cadres de concertation avec les acteurs des trois santé. On travaille ensuite en même temps à la documentation des résultats, à la capitalisation pour être capable de montrer l'impact positif d'un projet comme celui qu'on est en train de mener, et ça nous permet ensuite de porter un plaidoyer, comme je l'ai dit, et d'espérer à terme avoir une politique nationale au Sénégal, puisque c'est là qu'est ce projet-là, qui permettent d'adresser ces enjeux climatiques. Next and last, please. Voilà, pour respecter les 10 minutes, petite conclusion, on m'a demandé de donner 2-3 points sur les défis. Alors, évidemment, je serais heureux si on a un peu de temps de répondre à des questions là-dessus, mais ce que j'ai voulu mettre en avant sans prendre trop de temps, c'est au niveau organisationnel, la réalité de la difficulté, il faut le dire, de mobiliser une équipe dans une période, ça ne vous a pas échappé, qui est complexe en termes de mise en œuvre de projets et d'ambiance globale dans la solidarité internationale. D'autant plus, je prends là le troisième point, que nous, on est une structure avec des financements institutionnels, donc on n'a pas de fonds propres qui nous permettent d'investir dans des changements structurels. On est obligé de trouver des moyens avec des partenaires, avec des financements pour le faire, donc ça complique. Et puis, je signalerai aussi qu'on travaille dans des pays, vous avez vu, tels Guinée, Sierra Leone, en plus du Sénégal, la Côte d'Ivoire, où on va dire les infrastructures, la capacité de l'État à travailler, entre autres, sur tout ce qui est élimination des déchets, est assez limitée. Donc, finalement, les efforts que l'on voudrait mener ne sont pas forcément faciles à mettre en œuvre dans ce contexte-là. Au niveau programme, pour finir, c'est un appel aussi, la principale barrière pourquoi on a des projets que au Sénégal aujourd'hui, parce qu'on a des difficultés à trouver des financements sur les enjeux One Health et santé-climat. Vous savez que la santé est mal financée par les acteurs qui financent le climat, et que les opérateurs comme nous, très concrets, ont plus de mal à être financés que d'autres. Donc voilà, c'est un appel aux bonnes volontés. L'autre enjeu, c'est la difficulté de travailler en multisectoriel. Je pense que ça, on l'a souvent dit. Et puis un dernier point, c'est que, je ne l'ai pas évoqué dans la présentation, mais on va avoir une approche climat dans tous nos projets, donc être climate sensitive, on va dire, dans tous les projets. Et ça, c'est pas toujours évident, bien sûr, quand les projets ont d'autres objectifs et quand vous avez déjà des enjeux comme le genre et l'autre. Voilà. Je m'arrête là et je vous remercie beaucoup de m'avoir laissé ce temps d'intervention et je vous repasse la parole. Merci.
Serge, merci beaucoup. Moi, je retiens cette idée de production de temps. J'ai beaucoup aimé cette idée. I'm going to switch back to English. Should we maybe take one question? If someone has a burning question. Yes, there is a burning question. Great. Can someone give, yes, the microphone?
Merci beaucoup. J'ai une question pour Christophe. Christophe, par rapport au carburant, donc j'ai vu qu'il n'était que 7% par rapport à toute l'analyse, tout l'impact, mais effectivement c'est quand même 7%, c'est l'énergie fossile, donc je suppose du diesel. Est-ce que vous avez exploré d'autres possibilités ? Biodiesel, est-ce que le rétrofit serait possible sur les vaisseaux? Est-ce qu'une production locale d'hydrogène pourrait aider vos vaisseaux? Voilà, j'ai toutes ces questions-là qui sont en suspens. Et aussi au niveau du taux de recyclage de ces vaisseaux, est-ce que vous pouvez me donner le taux, le pourcentage?
Oui, merci pour la question. Alors effectivement, alors, should I answer in English or French? I'll answer in English. Okay, I'll answer in English. So, as you saw, 7%, actually it's 29%, the fuel aspect. Reducing our consumption is only 7 of those 29, which means that the remaining 22 comes from a single source that we've identified. It's moving towards biofuels. That is the major contributor to those 29% of our target reductions. We've got 2 experimentations underway at the moment, one in Le Havre and another one in Douarnenez in Brittany. The main challenge with that is going to be procurement. Right now we have this experimentation underway. We're partnered with Total Energy, who is also one of our historical funders. Okay, we know all of our fleet is compatible with biofuels, so we don't need to make any kind of effort to retrofit anything. We can put biofuel in immediately. We just don't know where we're going to buy it from tomorrow. So right now the experimentations are underway. It's confirming what our initial analysis, that it will have the impact that we're hoping for. We just, at the moment, have no idea how we're going to supply our entire fleet with those biofuels. To answer your other question about the recycling level of our ships, right now that is one of the major challenges we face. To be perfectly honest, we're not very happy with what we've done so far. We are at a moment where we are going to be renewing a lot of our fleet. One of the reasons why also we're looking at prolonging lifespan, it's also because it's cheaper. So this is where climate and carbon and money go hand in hand really well. It's also because we don't actually have any kind of satisfactory solution to recycle it. Most of our ships they're basically plastic, and the alternatives that we're looking at are actually a lot worse in terms of their carbon footprint. It's either aluminum or carbon, which is worse. And so right now we're either find people who actually we can sell them to, who are happy to. Developing countries, we have some we donate them, or we sell them to people who can reuse them, or we have them deconstructed, or actually what we're trying to do a lot at the moment is we put it in our reserve fleet, because our fleet is aging, so we have more and more longer on a plus d'avaries. Sorry, I must go back into French. And so we need these replacement ships. So we sometimes, for short periods of time, we have this sort of reserve fleet that we're using as well. The reality is we don't have a comprehensive strategy to recycle our ships at the moment, and it's one of the major challenges we face in the future.
Thank you, Christophe. I think we're going to proceed to the next panel, indeed. But thank you so much. Thank you, all 3 of you, for sharing. I think from ships to children to mangroves, it matters, and thank you for sharing. That's why we really wanted to put a spotlight on our partners. I'm going